Your vagina is a part of your body. Like any other part, it's important to know what's normal for you. This means understanding how your vagina looks, feels, and even smells. This knowledge is powerful. It helps you feel comfortable and confident in your own skin. Plus, it allows you to notice any changes that might signal a problem. Think of it like checking your car's dashboard. You glance at the gauges regularly to make sure everything is running smoothly. Similarly, paying attention to your vaginal health empowers you to take charge of your well-being. For more health tips and to stay informed, make sure to subscribe to our channel. Every vagina is unique, just like every woman. There's no one perfect look. Color can vary from shades of pink to brownish. The labia, the lips surrounding the vaginal opening, also come in different shapes and sizes. Don't worry about comparing yourself to others. Focus on what's normal for you. Generally, a healthy vagina is moist, not overly wet or dry. It may have a mild, slightly tangy scent. Don't be alarmed if you notice some white or clear discharge. This is normal and helps keep the vagina clean. Remember, your vagina is designed to cleanse itself. Dousing or using harsh soaps can disrupt its natural balance and lead to irritation. For more informative content, make sure to subscribe to our channel. Vaginal self-exams involve gently feeling your vulva and vaginal area. Regular self-exams are like getting to know your body even better. They help you become familiar with what feels right for you. This familiarity allows you to detect any changes early on. Early detection is key when it comes to vaginal health. It allows you to address any potential issues promptly and avoid complications down the line. Think of it like going to the dentist for regular checkups. You may not always have a cavity, but those routine visits help prevent bigger problems from developing. Similarly, self-exams empower you to be proactive about your vaginal health. Performing a vaginal self-exam is easy and only takes a few minutes. Here's how. First, find a comfortable spot. This is important because you want to be as relaxed as possible during the exam. Stress or discomfort can make the process more difficult and less effective. Choose a well-lit area where you can relax. Good lighting is crucial for visibility, allowing you to see clearly and examine yourself thoroughly. Your bathroom or bedroom are good options. Next, wash your hands. Clean hands are essential to prevent introducing any bacteria or germs to your vaginal area. Use soap and water to thoroughly clean your hands. Make sure to scrub all parts of your hands, including between your fingers and under your nails. This prevents the spread of germs. Then, get into position. A comfortable position will make the exam easier and more effective. Lie down on your back with your knees bent and your feet flat on the floor. This position helps you to reach your vaginal area more easily and comfortably. This will make it easier to reach your vaginal area. Use a mirror. A handheld mirror will help you see what you're doing and ensure you're examining the right areas. Hold a handheld mirror in front of your vulva. Adjust the mirror until you have a clear view of your vaginal area. This will allow you to see what you're doing. Gently feel around. Use your fingers to explore and get familiar with your anatomy. Use your fingers to feel the labia, the lips around the vaginal opening. Take your time and be gentle to avoid any discomfort. Notice any bumps, sores, or areas of tenderness. These could be signs of infections or other health issues that may need medical attention. Gently insert 1 or 2 fingers into your vagina. This part of the exam helps you check for any internal irregularities. Feel for any unusual lumps, bumps, or rough spots. These could indicate cysts, growths, or other conditions that should be evaluated by a healthcare professional. Pay attention to any differences in color, texture, discharge, or odor. These changes can be important indicators of your vaginal health. Compare your findings to what you know is normal for you. Keeping a regular check on your vaginal health helps you notice any changes early and seek medical advice if needed. Spotting the signs, changes to watch for. While every vagina is different, there are some changes that might signal a problem. It's important to be aware of these signs so you can take action if needed. Unusual discharge. A sudden change in the amount, color, consistency, or smell of your discharge can be a sign of an infection or other health issue. Pay attention to any discharge that is green, yellow, or has a strong odor. Itching or burning. Persistent itching or burning around the vulva or vagina can be uncomfortable and may indicate an infection, such as a yeast infection or bacterial vaginosis. Over-the-counter treatments can help, but it's best to consult a healthcare provider. Sores or bumps. New or unusual sores, bumps, or growths on your vulva or vagina should not be ignored. These could be signs of sexually transmitted infections, STIs, or other conditions that require medical attention. Pain during sex, discomfort, or pain during intercourse can be caused by various factors, including infections, hormonal changes, or other medical conditions. It's important to talk to your doctor to determine the cause and find a solution. Bleeding between periods. Any bleeding that occurs outside of your regular menstrual cycle can be concerning. This could be due to hormonal imbalances, infections, or other underlying health issues. Keep track of your menstrual cycle and report any irregularities to your healthcare provider. If you notice any of these changes, don't panic. It's natural to feel worried, but remember that many of these symptoms can be treated effectively with the right care. It doesn't necessarily mean something is seriously wrong. Many conditions are easily treatable, especially when caught early. However, it's essential to see your doctor or gynecologist to get checked out. Regular checkups and open communication with your healthcare provider are key to maintaining your vaginal health and overall well-being. Discharge decoded: what's normal, what's not. Understanding vaginal discharge can be confusing, but it's an important part of knowing your body. Vaginal discharge is your body's way of keeping everything clean and healthy down there. It helps to remove dead cells and bacteria, preventing infections. It's perfectly normal to have some discharge, and it can change throughout your menstrual cycle. Hormonal fluctuations play a big role in these changes. Normal discharge, typically clear or milky white, it may have a mild odor. This type of discharge is usually not a cause for concern. The consistency can vary from thin and watery to thick and creamy. These variations are influenced by factors like ovulation, sexual arousal, and even stress. Abnormal discharge: a change in color like grayish, greenish, or yellowish, a strong fishy or yeasty odor, or an unusual consistency such as cottage cheese-like or frothy could be signs of an infection. These symptoms should not be ignored. If you're ever unsure about your discharge, don't hesitate to reach out to your doctor. It's always better to be safe and get a professional opinion. They can determine the cause and recommend appropriate treatment if needed. Remember, your health is important, and taking care of it should always be a priority. Itching and irritation: when to seek help. Occasional itching or irritation in the vaginal area is common and usually nothing to worry about. However, if it's persistent or severe, it's important to see your doctor. Common causes: yeast infections, bacterial vaginosis, irritation from soaps or detergents, and skin conditions like eczema can all cause itching. When to see a doctor. If the itching is severe, doesn't improve with over-the-counter treatments, or is accompanied by other symptoms like unusual discharge, pain, or bleeding, your doctor can determine the underlying cause of your itching and recommend the best course of treatment. Section 8. Sores and bumps. Understanding the differences. Finding a new bump or sore in your genital area can be concerning. While many are harmless, some may require medical attention. Normal variations include small, painless bumps around the vaginal opening, which are often harmless hair follicles or glands. However, sores that are painful, don't heal, bleed easily, or are accompanied by flu-like symptoms, like fever and body aches, could indicate a sexually transmitted infection or another condition. If you notice any unusual sores or bumps, it's essential to see your doctor for diagnosis and treatment. Section 9. The importance of odor: trusting your senses. Your vagina has its own natural scent, which can vary depending on your menstrual cycle and other factors. While a mild odor is normal, a strong, unpleasant odor could signal a problem. Causes of odor changes include bacterial vaginosis, trichomoniasis, a sexually transmitted infection, a forgotten tampon, and poor hygiene. If the odor is persistent, fishy, or accompanied by other symptoms like itching, burning, or unusual discharge, it's essential to see your doctor. Don't be embarrassed to talk to your doctor about any concerns you have about vaginal odor. Section 10. Your body, your advocate. When in doubt, check it out. Remember, you are your own best advocate when it comes to your health. If you notice any changes in your vaginal area that seem unusual or concerning, don't hesitate to reach out to your doctor. Early detection and treatment are key to maintaining good vaginal health. Don't be afraid to ask questions, voice your concerns, and advocate for your well-being. Section 11. Embracing your health, a lifelong journey. Taking care of your vaginal health is an important part of overall well-being. By getting to know your body, performing regular self-exams, and seeking medical advice when needed, you can feel confident and empowered in your health journey. Remember, you deserve to feel your best, both inside and out.